Welcome back to Med Madness, the podcast where we explore essential topics in medical education and practice. I'm your host, and today we're focusing on error reporting systems and procedural safety. In this episode, we'll discuss the effective implementation of error reporting systems, ERS, strategies to prevent central line-associated bloodstream infections, CLABSI, and methods to prevent sentinel events in surgery. We'll conclude with a case study to illustrate these concepts in action. Let's get started. Error reporting systems, or ERS, are crucial tools in healthcare for identifying, analysing, and preventing medical errors. Effective implementation of ERS can significantly improve the quality of care and enhance patient safety. Here are some key elements for successful ERS implementation. First, hospitals should establish systematic procedures to investigate reported incidents. This involves collecting all relevant data, analysing the root causes, and generating actionable recommendations to prevent future errors. Next, the findings from investigations should be communicated back to the reporting individuals. This feedback loop maintains transparency and increases confidence among staff that their reports lead to positive changes. All frontline personnel who interact with patients, not just nurses and physicians, should be encouraged to submit reports. Clear criteria for reportable events should be established to avoid underreporting, especially of near-miss events. Maintaining confidentiality and anonymity in the reporting process is essential, ensuring that investigations focus on systems factors rather than individual blame helps eliminate fear of retribution. The reporting process should be straightforward and require minimal time and effort from the staff. Simplified forms and user-friendly interfaces can encourage more frequent and detailed reporting. Now, let's move on to preventing central line-associated bloodstream infections, or CLABSI. CLABSI are serious and preventable causes of patient morbidity and mortality. Here are some strategies to prevent CLABSI. Proper hand hygiene is the foundation of infection control. Providers should thoroughly wash their hands or use an alcohol-based hand sanitizer before initiating any sterile technique. During the insertion of central lines, full barrier precautions, including the use of sterile gloves, gowns, masks, and drapes, should be employed to minimize the risk of infection. The patient's skin should be prepared with a chlorhexidine solution before catheter insertion. Chlorhexidine is effective in reducing skin flora and preventing infections. Central lines should be inserted by providers with significant experience or under the supervision of experienced personnel. This reduces the risk of complications and infections. Whenever possible, use peripherally inserted central catheters or PICC instead of central venous catheters or CVC. If a CVC is necessary, prefer subclavian or internal jugular vein sites over the femoral vein to reduce infection risk. Limit the duration of central lines and remove them promptly when they are no longer needed. Avoid routine replacement of CVCs unless clinically indicated. Now, let's talk about preventing sentinel events in surgery. Sentinel events are serious errors that result in patient death or irreversible harm. Preventing these events requires robust systems-based strategies. Timeout procedures are critical safety practices that emphasize team communication and redundancy. These involve pre-operative verification of the patient's identity, the operative site, and the procedure by at least 2 providers, including the patient or surrogate. The surgeon should clearly mark each operative site with a permanent marker. Non-operative sites should not be marked to avoid ambiguity. A final timeout should be conducted immediately before the incision involving the entire surgical team. This final check verifies the patient's identity, the surgical site, and the planned procedure, ensuring all concerns are addressed. Team debriefings after surgeries or significant events help identify any issues that occurred and provide opportunities for learning and improvement. These discussions should be collaborative and focus on system improvements rather than individual blame. Next, let's bring these concepts to life with a case study from a large teaching hospital. The hospital was experiencing a higher than average rate of central line associated bloodstream infections, or CLABSI, and several sentinel events in the surgical department. A comprehensive review of their procedures was initiated. The hospital implemented a robust error reporting system with structured mechanisms for responding to reports. They ensured all staff members, including support staff, were encouraged to report errors and near misses. Feedback from investigations was regularly communicated back to the reporting individuals, increasing transparency and trust. The hospital reinforced strict hand hygiene practices and conducted regular training sessions. Full barrier precautions and chlorhexidine skin preparation became mandatory for all central line insertions. Only experienced providers or those under supervision were allowed to insert central lines. The use of PICC lines was prioritised over CVCs, and catheter duration was strictly monitored to ensure prompt removal when no longer needed. Timeout procedures were standardised with clear protocols for pre-operative verification involving at least 2 providers and the patient. Operative sites were marked clearly, and a final timeout was conducted with the entire surgical team before incision. Regular team debriefings were held after surgeries to discuss any issues and identify areas for improvement. As a result of these comprehensive changes, the hospital saw a significant reduction in CLABSI rates and sentinel events. The effective implementation of the error reporting system, combined with strict adherence to procedural safety protocols, created a safer environment for patients and improved overall care quality.